So I just felt the patient's pulses. His secondary complaint is chronic digestive issues. Nothing severe, but his digestive system just does not function optimally, and seems vulnerable to stress, which most people are. Totally normal. Patient also shows signs in his pulse of maybe some long-term emotional trauma, which is very common in our society. Happens to everybody, and I would say that's a huge role in chronic disease. So I'm just going to do a treatment to try to help relax him and bring blood to the digestive system. The first point I'm going to needle can be sensitive, but I'm pretty good at it. Take a deep breath in, breath out. How was that?
Barely felt that.
Okay. So I just needled the bottom of his foot and he barely felt it, which is pretty good. Take a deep breath in. Deep breath in. Breath out. Good. So I'm getting this point out of the way first because it's the bottom of his foot, which is very sensitive. So I want him to be able to relax. Take a deep breath. Breath out. How was that?
A little more painful than the other one.
So that one was a little more uncomfortable. But you didn't mind too much. I'm gonna close the blinds in a minute so you can rest better. So I detected what we call heart-kidney disharmony, which is pretty common in our society with so much stress and stimulation. And the patient experiences waking up in the middle of the night too often. That's a common result of stress especially as we get older. How are you doing?
I'm good.
I'm gonna give you an eye pillow too to cover your eyes. So when people get a treatment where they're lying on their back, I always put an eye pillow over their eyes to maximize the rest. So these are not surprisingly 2 points that affect the stomach, these 2 points. This is also a point to affect the tummy. And these affect the large intestine as well. Is that comfortable?
Uh-huh.